Environmental health is an integral aspect of public health, intricately linked to the quality of our air, water, and soil. The interplay between environmental pollution and health outcomes is profound, as exposure to pollutants can lead to a myriad of health issues affecting individuals and communities alike. Understanding the effects of air, water, and soil pollution on health is crucial for developing effective measures to protect ourselves and future generations from the adverse impacts of environmental degradation. Air pollution is one of the most pressing environmental health issues of our time. The World Health Organization has identified air pollution as a leading cause of preventable deaths worldwide, attributing millions of premature deaths annually to its effects. Pollutants such as particulate matter, nitrogen oxides, sulfur dioxide, and volatile organic compounds infiltrate the air we breathe, often originating from industrial activities, vehicle emissions, and burning fossil fuels. The health effects of poor air quality are far-reaching. Short-term exposure can lead to respiratory problems, eye irritation, and exacerbation of asthma, while long-term exposure is linked to chronic respiratory diseases, cardiovascular conditions, and even certain cancers. Vulnerable populations, including children, the elderly, and those with pre-existing health conditions, are particularly at risk. The impact on mental health is also emerging as a significant concern, with studies suggesting a correlation between air pollution and increased rates of anxiety and depression. Water pollution poses another significant threat to health. Contaminated water sources can harbor a variety of pathogens, leading to waterborne diseases such as cholera, dysentery, and hepatitis A. Heavy metals, pesticides, and industrial chemicals can leach into water supplies, posing serious risks to human health. For instance, lead exposure from water can result in developmental delays in children, while long-term consumption of contaminated water can lead to chronic health issues, including kidney damage and increased cancer risk. The effects of water pollution extend beyond direct health impacts. They can also disrupt ecosystems, affecting food sources and livelihoods, particularly in communities reliant on fishing and agriculture. In many developing regions, access to clean water is a luxury, and the burden of waterborne diseases often falls disproportionately on marginalized populations, exacerbating existing health disparities. Soil pollution, while less visible, is equally concerning. The contamination of soil can occur through the use of pesticides, industrial waste disposal, and the accumulation of heavy metals. Polluted soil can affect food safety, as crops grown in contaminated soil can absorb harmful substances, leading to the ingestion of toxins through the food chain. This is particularly alarming in agricultural communities where reliance on local produce is high. The health implications of soil pollution are extensive, with potential effects including neurological disorders, reproductive issues, and long-term chronic diseases. Furthermore, soil degradation can lead to food insecurity, as diminished soil health results in reduced agricultural productivity, ultimately impacting nutrition and overall health. Addressing the health impacts of environmental pollution requires a multifaceted approach. Public awareness and education are critical components in fostering a culture of environmental health consciousness. Communities must be informed about the sources and effects of pollution, empowering individuals to make informed choices about their environments. Advocacy for cleaner air and water standards is essential, pushing governments and industries to adopt stricter regulations to limit emissions and discharges of harmful substances. This includes transitioning to renewable energy sources, promoting sustainable agricultural practices, and investing in green infrastructure that enhances air and water quality. Moreover, monitoring and assessment of environmental health are crucial. Public health agencies need to implement robust surveillance systems to track pollution levels and their health impacts. This data can inform policy decisions, guiding interventions, and resource allocation to areas most in need. Community-based initiatives, such as local cleanup efforts and pollution prevention programs, can also play a vital role in mitigating environmental health risks. Engaging citizens in monitoring local pollution sources and advocating for cleaner practices fosters a sense of ownership and responsibility toward their environment. In addition to preventive measures, access to healthcare services is essential for addressing the health consequences of environmental pollution. Communities affected by pollution often experience higher rates of illness, necessitating accessible healthcare resources to manage and treat these conditions. Public health systems must be equipped to handle the unique challenges posed by environmental health issues, including providing education on the risks of exposure and offering screenings for pollution-related health problems. Collaboration among various sectors is vital for effective action against environmental pollution. Partnerships between government agencies, nonprofit organizations, and private sectors can lead to innovative solutions that address both environmental and health concerns. For instance, urban planning that prioritizes green spaces can improve air quality while promoting physical activity and mental well-being. Investments in clean technology not only reduce pollution, but also create economic opportunities, showcasing the interconnectedness of environmental health and economic stability. Finally, the global nature of environmental issues necessitates international cooperation. Pollution does not recognize borders, and thus, collaborative efforts are essential in tackling transboundary pollution challenges. Global agreements and frameworks, such as the Paris Agreement on Climate Change, highlight the importance of collective action in addressing environmental health threats. By sharing knowledge, resources, and best practices, countries can work together to mitigate the impacts of pollution on health and promote sustainable development. In conclusion, the effects of air, water, and soil pollution on health are significant and far-reaching, impacting individuals and communities across the globe. Understanding these effects is crucial for developing effective strategies to protect public health from environmental hazards. Through education, advocacy, monitoring, and collaboration, we can take meaningful steps toward a healthier environment and, consequently, a healthier population. The challenge is immense, but the potential for positive change is equally great, offering a path toward a sustainable future where the health of our planet and its inhabitants is prioritized.